And one of the studies that I think is very important for us to talk about is done by Dr. Bites out of the University of Minnesota. He demonstrated definitively that PolyMem actually controls inflammation. What he demonstrated is that PolyMem doesn't just control inflammation in the dermis and the epidermis, but even when applied to the skin, it controls inflammation in the muscle, in the deep muscle beneath. So what we're looking at in these slides are histology slides. So on the right-hand side of each of the images, you see something that says 100 micrometers, so that's one segment. So that one segment is basically the width of 2 hairs. The large purple structures the large pink structures are muscle cells. The little purple dots are inflammatory cells. And so the incisions were made like across there and across here and across there. And so what we're looking at is how much inflammatory cells spread from the primary site of the injury into the surrounding tissue. And what we can see is that for the inflammatory cells, in the first one where there's incision without anything placed on top of the skin, you can see how widely it spread, and then there's no difference between that and the ones that had gauze covering. Whereas in the one where PolyMem was placed on the skin, all the inflammatory cells are all concentrated right at the primary site of the injury, reducing secondary injury. And by reducing secondary injury or bystander damage, reduces the risk of infection and delayed healing, as well as reducing the amount of pain and bruising that is suffered.